of the most important questions that we get asked about hair transplants all the time is, what technique should I use? FUT, which is the strip method, or FUE, which is when individual hair follicles are taken from the back of the head one at a time? Well, the answer to that question depends on what you're looking for and what your desires are, goals, expectations, and what your fears may be. For example, the strip method, which is still the gold standard today, is where we take a strip of tissue out of the back of the head and we remove that tissue, hand that off to our skilled technicians who, under a microscope, divide it into follicular units, 1, 2, 3, and 4 haired grafts. And then the doctor will suture that area up, the hair falls back over that area, and you really can't identify anything. However, if you were to try to shave your head, you would see a line, so you would have a linear scar. For patients who don't want the linear scar whatsoever, the technique of FUE, or removing them one at a time, is the best method for that. However, this method is much more time consuming for the physician because the surgeon has to remove those follicles one at a time themselves. So, in other words, it can take 2, 3, 4, or even 5, 6 hours to harvest the necessary grafts that are going to be transplanted into the head. This takes away some of the focus with regard to the physician on concentrating on the recipient area or where we're going to transplant the hairs. In conclusion, the FUE procedure is best for patients who want to keep their hair really, really short or want the option to shave their hair. It's generally done for smaller sessions, or if there's a large session that needs to be done, it's going to be done over 2 days because, again, it's more time consuming for the harvesting process. If you want to do a large session and get the most number of grafts in the quickest time period while the grafts are cut under a microscope so we get complete visualization of those grafts in the time-tested technique, that's the strip method. And that's the best way to harvest the most amount of grafts in the shortest amount of time so that the physician can focus on the recipient site and creating the most natural look possible.